Pregnancy is a time of immense change, both physically and emotionally. As your body transforms to accommodate a growing life, it's natural for your relationship with your partner and your own sexuality to evolve as well. One aspect of this change that often raises questions is intimacy during pregnancy. It's important to remember that every pregnancy is unique, and there's no one-size-fits-all approach to intimacy. Open communication with your partner is key to navigating this journey together. Talk about your feelings, concerns, and desires. Remember that intimacy extends beyond intercourse. Explore different ways to connect physically and emotionally with your partner. Cuddling, kissing, and gentle touch can be incredibly intimate and fulfilling. Pregnancy can be a beautiful time to strengthen your bond as a couple. Embrace the changes, communicate openly, and prioritize intimacy in a way that feels right for both of you. It's completely normal to have questions and concerns about sex during pregnancy. Many expectant parents wonder if it's safe for the baby, if it will hurt, or if their changing bodies will affect their desire. Rest assured that for most pregnancies, intercourse is safe and won't harm the baby. Your baby is well protected by the amniotic sac, strong uterine muscles, and a mucus plug that seals the cervix. However, there are a few instances where your healthcare provider might advise against intercourse. These include if you have a history of preterm labor, placenta previa, cervical insufficiency, or unexplained vaginal bleeding. If you experience any pain or discomfort during sex, try adjusting positions or using pillows for support. Communicate openly with your partner about what feels good and what doesn't. While intimacy during pregnancy is generally safe, there are certain situations where it's best to err on the side of caution and abstain from intercourse. Your healthcare provider will advise you if any of these situations apply to your pregnancy. If you have a history of preterm labor or are experiencing signs of preterm labor, such as regular contractions or your water breaking, it's crucial to abstain from sex. Intercourse can stimulate uterine contractions and potentially lead to premature birth. Placenta previa, a condition where the placenta covers part or all of the cervix, also requires abstinence from intercourse. This is because intercourse can cause the placenta to bleed, which can be dangerous for both you and your baby. Cervical insufficiency, a condition where the cervix starts to open too early during pregnancy, is another reason to avoid intercourse. Intercourse can put pressure on the cervix and increase the risk of miscarriage or preterm birth. Section 4. Nurturing intimacy beyond the bedroom. Intimacy extends far beyond the bedroom, and this is especially true during pregnancy. While physical intimacy might ebb and flow, there are countless ways to nurture your connection with your partner. Communication is paramount. Take time to talk to each other about your feelings, fears, and expectations. Share your hopes and dreams for the future, and listen attentively to your partner's perspective. Physical touch can be incredibly comforting and bonding. Cuddling on the couch, holding hands, and giving each other massages can foster a sense of closeness and intimacy. Plan special dates or activities that you both enjoy. Go for walks in nature, watch movies together, or simply enjoy a quiet evening at home. Pregnancy is a transformative journey, and by prioritizing intimacy in all its forms, you can strengthen your bond and navigate this special time together. Section 5. The postpartum period, reconnecting after baby. The arrival of a new baby brings immense joy, but it also brings significant adjustments to your relationship and your sex life. It's common to experience a decrease in libido and to feel physically and emotionally exhausted during the postpartum period. Be patient with yourself and your partner. It takes time to recover from childbirth, both physically and emotionally. Focus on bonding with your baby and allow your body to heal. Once you feel physically ready, typically around 6 weeks postpartum, your healthcare provider will give you the green light to resume sexual activity. However, it's important to listen to your body and communicate openly with your partner. Keep in mind that your body has gone through significant changes, and it might take time to feel comfortable and confident with sex again. Use lubrication if needed, explore different positions, and focus on enjoying each other's company. Section 6. Debunking myths, water breaking, and the waiting game. There are many myths and misconceptions surrounding pregnancy and childbirth, and one of them pertains to water breaking. It's important to separate fact from fiction and rely on accurate information from your healthcare provider. One common myth is that if your water breaks at 2 centimeters dilated, you'll be whisked away to the delivery room immediately. In reality, labor can progress at different paces for everyone. While it's true that your water breaking is a sign that labor is approaching, it doesn't necessarily mean that labor will be rapid. Some women experience a slow trickle of amniotic fluid, while others experience a gush. If your water breaks and you're not having regular contractions, your healthcare provider might recommend waiting and monitoring your progress. They'll consider factors such as your medical history, the baby's position, and the presence of any signs of infection. The decision of whether to induce labor or allow it to progress naturally is a personalized one, made in consultation with your healthcare provider. Section 7. Seeking guidance. Your healthcare provider is your ally. Pregnancy and postpartum are unique and personal journeys, and it's essential to have a trusted healthcare provider by your side. Your healthcare provider is your go-to resource for any questions or concerns you have about intimacy, sex, and your overall well-being. Don't hesitate to discuss any anxieties or fears you have about intimacy during or after pregnancy. Your healthcare provider can provide you with accurate information, address your concerns, and offer personalized guidance. Remember, every pregnancy is different, and what's right for one person might not be right for another. Trust your instincts, communicate openly with your partner, and seek the support of your healthcare provider. By prioritizing open communication, self-care, and informed decision-making, you can navigate the realms of intimacy during and after pregnancy with confidence and joy.